Good day, friends. Carlos Bastardo with American Insurance Brokers here. And some of the most common questions I get about health insurance normally deal with deductibles, copays, and coinsurance, right? A lot of folks have a little problem trying to understand and fit those things together. So I'm going to give you just a quick lesson on how those things work, right? So your primary deductible for your health insurance plan is the overall, right, amount that you must meet out of pocket before the insurance company starts to pay. However, it can depend on what kind of plan you have. So if you have a high deductible HSA plan, right, everything's going to have to come out of pocket first to equal that deductible before your coverage actually kicks in, except for wellness. With most plans, especially if they're ACA or group, they're normally going to cover wellness at 100% where you don't have to pay anything out of pocket first. Okay. So you've got that deductible portion. Now, on the other hand, if you have what's called a copay plan, so if you see that your coverage, you pay $40 for doctor's visits, what that simply means is that if you go and you see the doctor and it's nothing serious, you just go in and maybe you got a cold, you pay the $40, you leave the doctor's office and you're done, right? You don't have to pay anything towards your deductible because it's a copay plan. Same with specialists. So if you have a copay for specialists, you're going to pay $60, for example. You would go and see that specialist and pay her $60. Okay. So a lot of times people get concerned. They see they have a 5,000 deductible. They're like, oh my God, I'm going to pay 5,000 before anything gets covered. No, that's only again if you have a high deductible plan. But if you have copays, then those copays are what you pay. Now, sometimes it can get a little confusing, but this is why it's important you read your outline of coverage, right? So the outline of coverage may stipulate the deductible first, then 30%, or deductible first and then $20. So some plans do have little caveats built into them where in that case, yes, now you have to meet deductible, but after you meet deductible, then you only pay so much. Okay. So again, deductibles overall plan, unless it's a copay plan, then you pay those copays and you don't have to worry about the bigger deductible. Okay. And then the last part of that is co-insurance. So we see copay, co-insurance. Most people think, what's the difference? It's the same thing, right? Copays, again, are for specified reasons. Doctor's visit, specialist visits. Co-insurance is the amount of a percentage that you have to pay after your annual deductibles met. So it's also important to understand what that number is so you know what your total out-of-pocket maximum is for any type of event. So for example, let's say you have a $5,000 deductible plan, and then it's 70/30 co-insurance after you meet the deductible, right? And then the maximum out of pocket or the amount you pay in terms of co-insurance is, let's just say, another 3,000. All right. So what that means is deductible of 5,000 is hit. Now the insurance company pays 70%, you pay 30% until you reach another $3,000 total of out of pocket, right? So combined all together, that's $8,000 maximum out of pocket that you're on the hook for. Okay. Now, for a lot of folks, that's a lot of money. I get it and I understand it. But a correlation of trying to keep deductibles a little bit higher, right, is to keep your premiums lower. And the common thing that people say when I say, okay, what's your budget? How much you looking to, or where you're looking to be at for paying for your health insurance benefits? As little as possible. I want a cheap plan. Okay, well, there's really no such thing as a cheap plan, only diminished coverage. So in order to find the best of both worlds, we have to push that deductible up some so that we can bring the premium down, right? So I actually like to look at some plans for my clients, maybe with the 7,500 or 10,000 deductible. Now you're probably thinking, you're crazy. I can't afford that. But right, by doing that, we're able to really push those premiums down here. And then I can also do add-ons for what we call ancillary products. So we have accident policies, for example, that if you get hurt, can pay you, five, 10, 15, $20,000 cash directly to you, which in turn you can use to pay deductibles and co-insurances. We also have critical illness ancillary products that function the same way. So if you're diagnosed with cancer, heart attack, stroke, it can also give you a lump sum of money, 5,000, 7,500, all the way up to heck, $50,000. And again, so if you had something major happen along those lines, right, you've got the money to use to help pay those deductibles and co-insurances, right? So if we have a copay plan with a higher deductible, we put those ancillary benefits in there, you're still going to be way cheaper than trying to buy a $2,500 deductible plan, right? So we can think outside the box, and we have great products to be able to structure that plan properly to make sure that you have a comprehensive plan at the end of the day, okay? But you have to trust us to put those things together for you and your family. We know what we're doing when it comes to those things, okay? The last thing I want to discuss is the network discounts. So a lot of times also I let clients know, hey, we do have to go with the higher deductible plan, this, that, and the other. However, you have to realize that, let's say United Healthcare, for example, going with this plan with United Healthcare gives you access to United Healthcare's network. So as long as you stay in the network, you're automatically going to get a 30 to 40% discount on the fees that you're being charged. So if you do have a high deductible and your bill would normally be $10,000 for services, and it gets reduced 40% just for being in United Healthcare's network, now the amount you're going to pay is 6,000 instead of 10,000, right? Still a good deal of money, but you're saving money because of the network. Now let's use it in smaller terms, right? Your bill's going to be $1,000 for a small procedure, right? And because of that 40% discount, now that gets dropped to 600, right? So definitely makes it a little bit more manageable. So when it comes to your health insurance, if you want to put a good plan together, we can look outside the box for you, make sure you have the best of all worlds. And then we do have the additional benefits like dental and vision and disability. So we can factor those things in together as well. Okay. So if you're interested in just finding out more, reviewing your plan, see what we can do for you in terms of health insurance, you can text me at 574-529-3099 or PM me here on Facebook or through YouTube, and I'll be more than happy to help you out. You all have a great day out there. God bless, and see you next time.